We looked at signs and symptoms of urinary tract infections, how to analyze the results of urinalysis, looking at urine cultures, starting empiric therapy, and de-escalating antimicrobials based on the culture results. Now the next learning objective is to select total duration of therapy based on specific antimicrobial agent selected. Majority of cases of uncomplicated UTIs include cystitis, so nitrofurantoin 5 days of treatment is adequate. With phosphomycin, total duration of therapy is just a single dose. Now these are in most cases. For example, if someone has ESBL UTI, a single dose of phosphomycin may not be adequate. For pyelonephritis with IV beta-lactams, total duration is 7 days. The same is true with fluoroquinolones, whether it's IV or PO.
And that would be 7 days total. So let's say if someone got IV beta-lactam for the first 3 days, and then they were switched to a fluoroquinolone, then they just do 4 more days of fluoroquinolones with plus the 3 days of IV beta-lactam to give you a total 7 days.
With Bactrim, 14 days is required, as well as PO beta-lactams. So because PO beta-lactams are inferior to IV beta-lactams, you need 14 days of treatment, and PO beta-lactams are last option.
Let's say if someone got 3 days of IV beta-lactam, then they get 11 days of trim sulfa to complete 14 days of treatment.
With complicated pyelonephritis, we do not have clinical practice guidelines. So in general, most clinicians agree on 7 to 14 days of treatment. However, there is clinical evidence that 7 days of treatment is sufficient for most patients with complicated pyelonephritis. So I would recommend 7 days of treatment for complicated pyelonephritis.